bagi Q kalau dah sedia. Okey, boleh mula. Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera dan selamat petang kepada rakan-rakan media. Berdiri sebaris dengan saya adalah Datuk Dr. Raizat, timbalan saya, dan kita bermula ya. Kementerian Kesihatan Malaysia ingin memaklumkan bahawa terdapat 24 kes yang telah pulih dan dibenarkan discharge pada hari ini. Ini menjadikan jumlah kumulatif kes yang telah pulih sepenuhnya dari jangkitan COVID-19 telah discharge daripada ward adalah sebanyak 183 kes. Sehingga 24 Mac 2020 jam 12 tengah hari, terdapat 106 kes baru yang telah dilaporkan. Ini menjadikan jumlah kes positif COVID-19 di Malaysia adalah sebanyak 1,624 kes. Berdasarkan siasatan awal, daripada 106 kes baru yang telah dilaporkan hari ini, sebanyak 43 kes adalah berkaitan dengan kluster perhimpunan di Masjid Jami' Sri Petaling. 63 kes lagi adalah berkaitan dengan kluster-kluster yang lain dan masih dalam siasatan untuk kepastian. Sehingga kini, seramai 64 kes positif COVID sedang dirawat di unit rawatan rapi ICU. Daripada jumlah tersebut, 27 kes memerlukan bantuan pernafasan. Duka cita dimaklumkan sehingga kini terdapat tambahan 1 kes kematian yang telah dilaporkan ke Crisis Preparedness dan Response Center Kebangsaan. Dan ini menjadikan jumlah kumulatif kes kematian COVID-19 di Malaysia adalah sebanyak 15 kes. Kes kematian ke-15 merupakan kes 1,519. Lelaki warga negara Malaysia berumur 70 tahun. Beliau mempunyai penyakit kencing manis dan darah tinggi dan disyaki mempunyai sejarah kontak dengan kes positif COVID-19 iaitu kes kes 703 ataupun 703 semasa solat Jumaat. Beliau mempunyai gejala selama seminggu iaitu demam, batuk dan kesesakan nafas untuk 3 hari. Beliau telah dirawat di Hospital Pakar Sultanah Fatimah Muar pada 18 Mac 2020. Kesihatan beliau merosot dan telah diberi bantuan pernafasan di unit rawatan rapi dan kemudian dia disahkan meninggal dunia pada 24 Mac jam 5.35 pagi. Kementerian Kesihatan Malaysia ingin mengucapkan takziah kepada ahli keluarga beliau. Untuk makluman, ujian yang dijalankan di Makmal Fasilitis Kesihatan Kerajaan bagi mengesan jangkitan COVID-19 adalah dengan menggunakan teknik real-time reverse transcription polymerase chain reaction, iaitu PCR. Ujian PCR yang dijalankan akan mengesan kehadiran virus COVID-19 yang terdapat di dalam badan pesakit. Justru ujian PCR yang positif bermaksud individu telah dijangkiti oleh virus COVID-19. Keputusan ujian yang tepat melalui teknik PCR adalah amat penting dalam pengurusan pesakit COVID-19. Manakala ujian melalui teknik rapid test kit yang kini terdapat di pasaran adalah mengesan antibodi yang terhasil di dalam badan akibat jangkitan yang dialami. Antibodi muncul di dalam badan sekitar 5 hingga 8 hari selepas jangkitan. Ujian rapid test kit yang mengesan antibodi tidak dapat mengesan virus. Ini menyebabkan ia tidak dapat membantu dalam pengesanan awal COVID-19. Justru ujian rapid test kit yang mengesan antibody tidak disarankan untuk tujuan diagnosa COVID-19. Kementerian Kesihatan ingin menasihatkan orang ramai untuk berada di rumah sepanjang tempoh penguatkuasaan Perintah Kawalan Pergerakan. Orang ramai dinasihatkan agar terus mengekalkan jarak sosial lebih dari 1 meter antara satu sama lain. Orang ramai digalakkan untuk melakukan aktiviti indoor bersama ahli keluarga. Untuk makluman umum, merujuk kepada jangkitan COVID-19 di kalangan jemaah tabligh, iaitu kadar jangkitan adalah 60% daripada jumlah keseluruhan. Dan janganlah kita persalahkan jemaah tabligh. Janganlah kita diskriminasikan jemaah tabligh. Janganlah kita stigmakan jemaah tabligh. Apa yang penting adalah kita membantu mengesan dan mengawal jangkitan COVID-19 di kalangan jemaah tabligh dan kontak mereka. Sekian, terima kasih. Kalau ada apa-apa soalan. Jadi, okey, saya jawab soalan kedua dulu. Dari segi taburan jangkitan penyakit COVID-19 ni, memang kita dah melihat kepada negeri dan juga pada daerah-daerah. Jadi, setiap daerah tu ada, boleh rujuk pada Kementerian Kesihatan ataupun KKM Putrajaya, nanti kita akan siarkan bersama daerah mana yang terlibat, kes-kes yang terlibat. Yang berisu mengenai tabung darah, memang kita ada kekurangan, tetapi juga penggunaan darah pun dikurangkan sebab hospital-hospital kita telah tangguhkan pembedahan elektif contohnya dan kurang penggunaan darah. Tetapi kita masih melihat bagaimana kita dapat melaksanakan kempen demam darah. Mungkin kita akan laksanakan perkhidmatan mendapatkan darah untuk rumah ke rumah contohnya. Kalau kita mungkin ada hotline, kalau hotline mereka nak demam darah, kontak ataupun hubungi Kementerian Kesihatan ataupun tabung darah dan kita akan ke rumah tersebut untuk mengambil darah.
After 1 week of the limitation, how is the effect for the limitation? What's the biggest challenge and difficulties now facing?
Okay, our action now is everybody have a responsibility, and this is unprecedented for the government to implement MCO. That means a movement control order. This is the first time we are doing it, and it's the period of 1 week is rather short for us to access. But more important is that we intend to break the chain of transmission of the virus. If everyone stay at home, that's a message that we want. Stay at home. For every individual, stay at home. Wash your hand, and distancing yourself. That you will help Ministry of Health to break the transmission of the infection. And that's the reason why we have this MCO in place. More importantly is that we also need to protect the elderly at home. And if we are confined to our house, the infection will be less. That's the idea of the whole exercise. In the meantime, the Ministry of Health will enhance our public health activities. For example, active case detection, meaning that we will find the cases. We find the cases, we test the case and confirm, and then we isolate them, and then we treat them. So we will continue to do our best to look into the focus group. For example, now we know that 60% of the infection is among the tabligh group. Then we will go after the tabligh group to treat, to isolate, to detect them, and then to test them to make sure they are not carrying infection or infecting others. So that is how we're going to take our active participation in terms of contact tracing. In the meantime, we also take initiative to clean our environment, for example, whatever needs to be done, and then to act accordingly, to take all the precautionary measures, public health measures, and to maintain good personal hygiene for all.
How long will Malaysia need?
Now we start off with a cycle of incubation period of 2 weeks. So we will review maybe at the end of the week or even end of before the 2 weeks whether they respond. So now we can see the trend. What we do today is we are trying to prevent in the increase of cases, for example, in the next couple of weeks. So what we have today, it was the result of what we have done in the last 2 or 3 weeks ago.
So far, how many clusters have you detected?
Now the clusters that first wave is very easy because basically it's related to warga negara China, right? Second wave, we have a few clusters. So far, the main cluster is the one related to case 26 that infected 114 patients, for example. And what's more important, they are small clusters, but we are looking at the clusters, maybe perhaps they are first generation, second generation, and third generation related to the Jemaah Tabligh. So this is why index case been identified. Index case we have 986 Jemaah Tabligh been identified positive for COVID-19. Then this is the index case. They could have infected the first generation, the family members, for example. Second generation, the family members infecting their friends, for example, neighbors. And third generation, the neighbors infecting another person. So we already have the chain of infection, first generation, second generation, and even fourth generation been detected. So can you imagine for 986 index case, so looking into the network of the change of infection among themselves to first generation, second generation, and third generation.
Have you detected any if it has become sporadic in the future?
The first sporadic case that we detected was in Bentong and then referred to Kuantan. And when we thought it was a sporadic case because we are doing surveillance in terms of SARI, severe acute respiratory infection, as well as those of you who have influenza-like illness, for example, you come to our clinic, we will actually measure, whether and test whether you have COVID-19. So our first sporadic cases we detected in ICU, that is actually a SARI patient, severe acute respiratory infection in Kuantan. But when we trace back the history, there was a history linked to the attendance in Jemaah Tabligh in Sri Petaling.
So could you introduce the conditions of the medical workers because some of them infected and how to solve the problem of the not enough because most of the countries are facing these difficulties?
So the medical personnel that is our frontline workers that have been infected, none of them are involved those working in the COVID ward and the ICU. None of them. In other words, perhaps that is most safest place, because why? All our healthcare workers, they have protective equipments and etc. So they are protected. But the one that infected our healthcare facilities, mainly they attended function, for example, mosque gathering, for example, and they got contracted the virus there and bring the virus to the clinic or bring to the hospital. So this is one. Second is that the patient that comes to us do not declare or even inform us that they are related to a positive patient. And when we provide the treatment, and after the treatment being given, then only the history been revealed that they have a contact positive. And then when we test the patient positive, then we have to take care of ourselves and make sure that we are also being tested. So the infection is not mainly from the patient, but it is actually from the community, whether it's a wedding function or whether it is actually a public gathering. In the past, you look in the 2 weeks ago, we were trying to see, because tabligh group involved those gathering in surau, in the madrasah, as well as in the mosque. So they could have infected others in doing the gathering. pada mulanya kita ikut garis panduan daripada Pertubuhan Kesihatan Sedunia. Kalau ada gejala baru kita ambil sampling ataupun test, dan mereka kita dah saring lebih kurang 13,000 jemaah tabligh, kita 13,000, dan ujian yang kita laksanakan yang untuk mereka yang ada gejala 8,000 lebih. Jadi mungkin ada yang pada peringkat permulaan, ada yang kita tak lakukan ujian tapi kita saring mereka tak ada gejala. Mereka yang kita saring 8,000, yang positif ialah 986. Jadi sekarang ni kalau ahli jemaah tabligh yang ada gejala tampil ke depan untuk ke klinik kesihatan supaya kita boleh laksanakan ujian tersebut. Dan mereka yang tak ada gejala datang juga ke klinik kesihatan, dan mungkin kita akan jalankan saringan tersebut dan juga ujian tersebut. Sebab sekarang ni kita kena pasti jemaah tabligh risikonya lebih tinggi. Sebab yang kalau kita lihat keseluruhan daripada jumlah kes yang kita ada 1,624, 986 melibatkan jemaah tabligh. Jadi sekarang ni kita punya high index of suspicion priority. Kalau mereka datang, kita akan melaksanakan ujian tersebut. Arahan telah dikeluarkan tetapi mungkin memakan masa. InsyaAllah rasa by tomorrow. Jadi kalau keesokannya mungkin akan dilaksanakan. That's right. InsyaAllah.
Could you say something more about the death rate? Because more people died in the past week.
The death rate, because if you look into the 15 cases that we have, the first case that we have involved a pastor, and again, some of our death rate, they have comorbidities, for example, diabetes, hypertension. Secondly, you look into our death rate, the age group. Age group, most of them are more than 70 years of age. So that's another high-risk group. Age is one of the indication of a high-risk group. Second is the NCDs. And third is most of the tabligh group, if I'm not mistaken, 9 of them came to us at a very late stage. As I explained, there's 5 stages. Stage 1, asymptomatic but positive. Stage 2, positive but mild symptoms. Stage 3, they have some form of pneumonia, but they do not require oxygen supplement. Stage 4, they require oxygen supplement therapy. Stage 5, they couldn't breathe well and they will need to intubate them and then put on ventilator. So most of them comes either stage 3, because the last patient, for example, they already have symptoms of difficulty in breathing for the last 3 days. So he came in already about stage 3 or stage 4, needs oxygenation and all. So, and then they deteriorate very fast to stage 5. So this is why one of the contribution to the fatality is because of delay in presentation to our hospital and clinic. Kalau untuk infectious disease untuk COVID, surat keliling telah dikeluarkan pada 29 Januari, di mana rawatan, pengesanan semua kita akan tak perlu kenakan fee. Jadi ada surat keliling tersebut. Tetapi untuk penyakit lain datang, contohnya untuk batuk, demam ataupun benda-benda lain, fee masih apply untuk mereka lah. 700 ialah kos untuk yang fee untuk test tu. Memang kalau kita lihat test tu di di private sector, dia charge dalam RM700. Jadi di Kementerian Kesihatan kita tak charge.
Datuk, mengenai pengambilan pekerja kontrak 2,000 tu, bila ia akan berkuat kuasa?
Kita dah ada kena pasti seramai 3,000 staff, contohnya staff nurse yang telah pencen dan akan kembali untuk membantu Kementerian Kesihatan. Jadi kita nama dah ada, tapi kita tengah dalam urusan untuk pengambilan staff-staff tersebut.
Datuk, saya dari Menama, saya ada 3 soalan di sini. Viral di dalam Twitter, 3 pelajar dari sebuah penerbangan London ke Malaysia pada 18 Mac didapati positif Covid-19. Adakah KKM mempunyai maklumat ini? Soalan kedua, jika kita lihat di pasaran topeng muka dan juga hand sanitizer, kita dapati ada banyak mask DIY dibuat daripada fabrik pun ada, yang dijual malah disumbangkan juga kepada frontliners. Adakah ia mematuhi piawaian dan mampu mencegah virus COVID-19? Begitu juga dengan hand sanitizer yang dibuat secara OEM, dijual begitu meluas secara dalam talian. Adakah ia selamat dan tidak mendatangkan sebarang risiko kepada kesihatan kepada pengguna? Soalan ketiga mengenai SOP lawatan waris selepas pesakit COVID meninggal dunia dan dikebumikan, berapakah jarak waktu waris boleh melawat kubur dalam konteks mencegah virus tersebut daripada merebak? Terima kasih.
Okey, saya jawab yang soalan terakhir, iaitu kalau dah pengurusan jenazah dah dilaksanakan, jadi tak ada isu. Jadi jarak dia pun 1 meter ataupun 2 meter daripada kubur tak ada isu. Yang sanitizer dengan mask memang ada, kalau kita kena lihat sama ada pengesahan daripada Kementerian Kesihatan ataupun cara pembuatannya lah. Jadi bukan hanya dibuat di belakang rumah, tapi ada kilang yang terlibat, mana siapa yang producer yang manufacture the whole thing lah. Yang soalan seterusnya apa? Banyak sangat soalannya.
Kapal terbang.
Kapal terbang. Jadi kita dalam gelombang kedua kita lihat banyak imported cases lah. Tetapi masalah dia sekarang ni virus COVID sudah ada dalam masyarakat. It's already in the community. Jadi kalau dah already in the community, tindakan kita ialah tindakan MCO lah. Basically perintah kawalan pergerakan, yang tu that's most important. Jadi mereka balik kat situ, mereka yang balik berluar negara, kita kena ambil, kita akan laksanakan saringan di airport, dan kalau mereka ada gejala, terus kita akan ambil sampel. Mas. Ya.
For most
Sarung-
of the
sarung muka.
countries facing the COVID-19 battle, they will experience the period of shortage of the medical workers. So, what can Malaysia do in the future?
So in terms of the medical healthcare workers as well as the facilities, we cannot build a hospital in 10 days. Neither can we employ our medical, increase our healthcare workers. But what we are doing is deploy. That means healthcare workers that is actually from other states are coming here. Now we already deploy other states coming to Selangor, for example, to Sungai Buloh Hospital to assist us. Then we decant some of our hospital. We identified 26 hospital plus another 7 hospital, 33 hospital plus University Hospital. We decant, and then hopefully they can actually manage and create beds for COVID patient as well as the ICU beds for them. So by doing so, we have actually postponed all the elective operation. We have actually referred the patient from the COVID hospital to the non-COVID hospital and also to the private sector as well. So by doing so, we have freed our beds in the hospital. For example, in the Sungai Buloh Hospital, we managed to create 1,350 beds. And also we are using the nurses' quarters and those cases that is stable but positive, asymptomatic but positive, or symptoms but stable but positive, we also will send them to our nurses' quarters, and we free the hospital for moderate cases or severe cases needing more critical attention. Okey, mask tu kita dah siapkan dalam KKM Putrajaya, iaitu mereka kalau ada gejala, kalau demam, ada sesama, pakai mask. Kalau tak ada, yang healthcare workers, kalau kita bekerja berdepan dengan orang ataupun pesakit, kita galakkan pakai mask. Dan juga mungkin kita berjumpa dengan ramai pelanggan kita, mungkin kita kena pakai mask. Tetapi mereka, kalau kita tak ada dalam kumpulan tersebut, mungkin tak perlu pakai mask, tetapi memadai kalau kita ada pengasingan penjarakan sosial ni. Dan kalau expose the mask, kalau kita pakai mask tu untuk tempoh 8 jam, lepas tu kita expose, kita gunakan tempat yang tertutup. Jadi kita buka mask tu, buang kat tempat tong sampah yang tertutup, dan lepas tu kita cuci tangan. Kalau cuci tangan, tak semestinya guna sanitizer, tapi guna sabun. Untuk sekurang-kurangnya 20 saat cuci tangan. Jadi kalau kita cuci tangan dengan baik, kita boleh membunuh kuman ataupun virus COVID-19 tu. Sabun dengan air.
I have two questions. First question is, Dr. you mentioned there's issue perkembangan darah, there's lack of vaccination. So would you, and I mean, is it okay for the public to, if they want to go donate blood for this?
Now because we have this MCO in place, so we try to innovate now. Innovate means we are doing some form of Uberization. Instead of you coming to the blood bank, is it possible for us to go to your home to collect the blood from at home, in your place, for example? So we are trying to do that, and then hopefully there's a number. Those who want to donate the blood, call us, and then we will send our team to the home and to donate. To take your blood.
The second question is about the case of paternity today. The patient was 1,519. So does that mean that his sample has been proved that it's positive to COVID today, then he passes?
No, not necessarily, because the numbers, there's also number reported to us. So if you look into the numbers that we have today, it is 1,624. So this patient is been, basically is 1,519. So it's actually after 105 patients.
Because the cumulative cases yesterday was 1,500.
Yeah, because the accumulation, that's what the numbers been given to us based on the diagnosis. So he fall into 1519 of the total of 1924. 1624, sorry.
Hello, besides the suspected patient from Tamin cluster, do you think it's really quick for now to just test other suspected patients?
So what we are doing now is to increase the capacity of our lab. So our lab, we started with testing, the total testing test per day is about 3,500. Now we have increased the capacity to about 7,000 a day. So we have actually increased the capacity further to test, perhaps by end of this month, we should be able to test 16,000 cases. Now, if we look into, once we have this capacity to test, and we are also testing a few antigen, rapid test kit antigen. So we want to use the test. That means if we can test more people, asymptomatic, and if it's positive, then we will isolate them, and then we'll treat them. So once we have a lockdown ataupun MCO in place, then we continue to look into the target group. So we'll have a target approach. For example, certain group that we think there's high risk, then we'll target them. And if we can pick them up early, that will be much better. And then we will isolate them and we'll treat them. So that is our, our plan in terms of to use this test. Now, if we learn from the Korean experience, they do about 20,000 tests a day. So we are not that far. We are doing about 16,500 in next 1 or 2 weeks time. So we will continue to test more people, and hopefully we'll be able to detect more. And by detecting more and taking the infected patient out of the society or the community, then we may flatten the curve. Flatten the curve means that our capacity of a hospital, we are really enhancing our hospital and able to treat the patient well. So you can see today that we have 64 patients managed in the ICU. And out of the 64 patients, we have 27 patients, if I'm not mistaken, 27 patients already on a ventilator. And if we treat them well, and then they can actually recover in time. The only worry is that when there's a surge, exponential spike, and the capacity is limited, then we have to choose which patient will have the privilege of ventilation. So we hope that we do not come to that stage to decide which patient can have ventilation and which patient cannot have ventilation.
Do
So what is more important for us to prepare for the worst and then hope for the best? So we are preparing for the worst, creating 3,400 beds, and should we need beds further, we will convert our training institute, there's hostel and a training institute, to become a ward, for example, because we cannot build hospital in 10 days. But at least we can convert our institution, training institution, to become a ward. And hopefully by doing so, we can create more beds. And this is why I think we need to plan in terms of human resource, we need to plan in terms of the facilities as well as the equipment all in place. So we are ready for that, but we still need to look into we still have to prevent the exponential spike of cases. So by doing the MCO, we hope that can reduce the infection and transmission of the virus and less patients being infected, because the virus is already in the community. And we want each and every individual to make sure that you take care of yourself and stay at home and practice hand washing frequently and a distancing among family members as well. So if you don't mix around, then the transmission of infection, so we break the chain of transmission of infection. That is exactly what we want. And in the meantime, the public health will come in to look into active case finding, especially in the target group, as I mentioned earlier. And in our hospital, we enhance our healthcare facilities in the hospital to be ready. Should positive patient comes to our facilities, we can provide the best quality of healthcare. Today, if you look, we have 15 deaths, and if you look into the fatality globally is 4.5%. If it's 4.5%, we are expecting 45 deaths. So, but we have 15 deaths at the moment. So we hope that we can maintain, and we hope that those who have symptoms, difficulty in breathing, please come to the hospital as soon as possible. Do not come to hospital at the stage 3, stage 4, or even worse, stage 5. So come early. If you have mild symptoms, come early, and we can actually, 80% of our patients is categorized under mild symptoms. That is stage 2.
Are you confident in preventing the situation in Europe happen?
No, failure is not an option, but whether we succeed or not, it not only depends on the Ministry of Health. It depends each and every individual in this country to follow stay at home. If you stay at home and you break the transmission of the virus, then we can decrease the peak, and we can decrease the exponential spike, and we can flatten the graph. I mean, if we can flatten the curve, that means that our capacity still will be maintained in the hospital. So we do not want a surge of cases that overrides our capacity in the hospital.
The 2,000, you want to recall those who have retired. Do you have any criteria for them, and where would you place them because of their old age?
No, we will mobilize. Most important, we have the staff. Then we will mobilize our staff and then look into their expertise in which area. And we have 3,000 retired nurses, for example, already registered with us. So we will mobilize them, whether it's a clinic or whether it's a hospital. If they are expertise in ICU, then probably we'll place them in ICU. So we need to look into each and every one of them in terms of their experience and expertise. Virus bergantung pada host. Kalau tak ada host, virus itu akan mati. Tetapi mungkin dalam jangka masa yang dekat tu virus masih aktif lagi. Jadi bila kita dah ada proses pengurusan jenazah, jadi bila dah meninggal, kita masuk dalam plastik, kita dah seal dan kita akan steriliskan. Lepas tu tayamumkan, contoh kalau orang Islam tayamumkan, dan kita akan bawa ke kubur lah. Dan proses tu akan berjalan macam biasa. Jadi jangkitan tu kurang kalau kita tak mandikan virus jenazah tersebut. No, the test initially we started looking into in terms of how many sample that you have. So the test when we started about 4 to 5 hours, but now because the volume has increased, then it takes time for us to process. PCR is very accurate, almost more than 98%, 99%. I would say 99.9%, right?
Contoh, kalau kita melihat jangkitan meningkat, adakah itu bermakna pengesanan yang dibuat oleh Malaysia?
Jangkitan meningkat sekarang ni ialah sebab 2 minggu lepas jangkitan telah ada dalam komuniti. Jadi kalau kita lihat 2 minggu lepas, saya sedaya upaya cuba kita mengekang ataupun membendung jangkitan kuman ini, jadi 2 minggu lepas di kalangan jemaah contohnya. Jadi salah satu daripada muzakarah yang kita adakan hari itu ialah untuk kita tangguhkan ataupun hentikan solat berjemaah, sebab jangkitan ini dibawa oleh jemaah tabligh. Dan jemaah tabligh kita tahu dia akan ke rumah ataupun dia akan solat berjemaah. Jadi jangkitan ini akan menular di surau, madrasah dan masjid. Jadi yang ini adalah tindakan kita 2 minggu lepas. Apa yang kita lihat sekarang ni mungkin adalah hasil daripada tindakan kita dalam tempoh seminggu ataupun 2 minggu lepas. Jadi apa yang penting ialah sekarang ni apa yang kita laksanakan sekarang ataupun minggu depan kita akan lihat implikasi ataupun jangkitan dalam tempoh 14 hari lagi.
Do you foresee that we might be like this?
It depends on us now. I'm throwing back the question to you. If you follow our instruction, help Ministry of Health, help the government to stay at home, to break the chain on infection, then we have a small opportunity to break the transmission of the virus. But if we do not follow our instruction, despite whatever been done by Ministry of Health, the virus will continue to spread. So the choice now, the succeed or failure is depend not only on Ministry of Health, but in each and every one of you.
Untuk kalau lihat kehidupan rumah ni, yang kita lihat Kementerian Kesihatan melihat rasanya virus ni, perlu dilanjutkan ataupun tidak?
Kita akan kaji. Sekarang ni kita memantau dengan rapi setiap hari sampai tempohnya mungkin hari ke-10 ataupun hari ke-12 kita akan lihat sama ada kita kena kaji ataupun kena lanjutkan. Nanti kita akan kaji dulu sebelum kita bagi satu keputusan.
Kalau dilihat pihak berkuasa masih lagi mengamalkan sikap penasihatan walaupun masih lagi ada yang dingin. Do you think that they should be more stern in this?
Well, we are trying to use the carrot first. I've been using the carrot for the last couple of weeks, but perhaps it is time for us to use the stick. So the choice is actually, the public.
Adakah kita siasatkan pasal JKN Kelantan dalam pasal turun jenazah?
Mungkin ada silap faham antara JKN Kelantan dengan polis dan sebagainya. Jadi kita telah lihat dan siasat perkara itu dan kita telah memperbaiki standing operating procedure kita lah. Okey, terima kasih.